All right, welcome everybody. This is Dr. Jody, and today I'm going to be interviewing a very dear friend of mine, Danielle Hargenrader, and we are going to be talking about why love is an essential element of type 1 diabetes care. So, I mean, what topic could be better? I talk about, how to set your basal rates and how to not go low with exercise and how to dose for your dinner, but I mean, those are all needed, right? But this is such a good one, so I'm very excited. Catherine's give us a little heart. Thank you, Catherine. Danielle Hargenrader, you got to unmute yourself, my dear. I'm going to mute everybody except Danielle. Hold on, mute all except then now Danielle. I will unmute you. Hold on, Danielle. Where'd you go? All right, there we go.
All right. I'm all unmuted.
All right. Okay, so without any further ado, Danielle Hargenrader, tell us about yourself.
Oh, about myself. All right. Well, my name is Danielle Hargenrader. However, over the years, I actually am in the process of changing my name to Danielle Love, and not because any other reason other than that Hargenrader is a really tough name. My husband is amazing, the best husband I could ever have in the entire world. We've been married for almost 14 years, but Hargenrader just is a little too hard for me. And Love is more encompassing. So I go by Danielle Love. I have lived with type 1 diabetes for 30 years. 2021 is my 30-year diaversary. It will not be until September, but I don't know the date. The very short story is that I was diagnosed in 1991. I went through very severe clinical depression. I was obese by the time I was 13. I had a very serious food and eating addiction, an eating disorder. And through my just insatiable desire to understand myself better and to live a life that felt joyful and fulfilling and not restricted, I went through my own learning journey where I went to school and got my degree in nutrition science. I also went to school and became a personal trainer with a 500-hour in-person course to really understand the anatomy and physiology of the human body and how that reacts with food and emotions. And I've also had over 5,000 hours of unique psychology training through all kinds of different programs, anything from Tony Robbins to Brendon Burchard to Raw Goddess to all of these different ways to look at the human mind, body, and spirit as a whole. And so through that whole journey, I've become, the diabetes dominator. That's my brand. That's my book. But the funny thing is that brand and everything got created in 2009. And now I feel like the only thing I ever dominate anything with is love anymore. And so it kind of feels like an interesting middle ground to meet there. So I dominate things with love. And that's kind of how I treat my diabetes, with lots and lots of love. And that works out very well for me and my clients.
Well, I love your story, and it's even me as your friend. It's really an honor to be reminded about how much training you do have. And I always love to tell our story. So I'm going to take a second to tell our story.
Yes, it's a great story.
I think Reva just got on. I think Reva Greenberg, who is an incredible type 1 author, blogger, speaker. I was talking to Reva somehow. I don't even know how Reva and I got connected. And Reva said, oh, there you are.
Hi, Reva. I just saw her too.
Hi, guys.
Hi, Reva.
And I see Nikki too. Okay, sorry. I'm not going to start calling people out, but I see Nikki Panda too, who I love.
Yeah.
So I thought I'd be incognito. You blew my cover.
Yeah, Reva's a very accomplished type 1 diabetes author and speaker and blogger. And I was chatting with Reva and she's like, oh, there's this amazing woman you have to meet. Her name's Danielle Hargenrader. I was like, okay, sure, I'll meet anybody. So Danielle and I have a Zoom call and we become like instant soul sisters. And I said, well, there's this diabetes conference in Vegas that is happening, I think in, who knows, it was like 6 weeks or something. And I said, I have a hotel room. If you want to like come and be my roommate in this hotel room, you should come. And she goes, oh, that's a good idea. she's like, I'm somebody that will do something like that. Are you serious? I'm like, yes, I'm 100% serious because I'm somebody that does something like that too. So it was like, I don't know, a couple of days later, a week later, she sends me her, flight itinerary. And I said, okay, it's great, we'll do this. And she goes, well, but I get in at midnight. I'm like, oh, okay, well, here's my room number. Just come in. Don't wake me up. I don't like to be, I don't like my sleep interrupted. And we'll just meet in the morning when we wake up. So that's what we did. She snuck in the room, went to bed, and then we woke up and we're like, hey, nice to meet you.
That is the truth. And that was in 2015.
Yep.
And so I literally slept in a bed next to Jody, having never done anything but speak to her on a Zoom call, just being like, she seemed like she won't kill me. So let's just get some sleep. And it worked out really, really, really well. So.
Wonderful. Okay, so let's dive into why love is an essential piece of diabetes care that's yet unfortunately so often left out.
Yes. Well, okay. So for me, this was a big, huge part of my journey that I found to be extremely prevalent to treating diabetes. And so I find for me that diabetes is a lot more mental and emotional than it is medical. Although if you don't have the medical pieces in place, then you might as well just, forget about the mental and emotional side too. But for me in my journey, while I was suffering with clinical depression and an eating disorder and a really, really, really low level of self-worth, the thing that was missing for me was self-love. And I didn't really understand that as a young teenager, but as I became older and older, I realized that it was the value that I placed on myself that was the missing kind of the X factor of my diabetes management. Because before that, I had this belief system that it was diabetes was killing me. Diabetes was out to get me. Diabetes was my enemy. Diabetes was this, diabetes was that. I was giving it all these human attributes that weren't actually true. Diabetes in and of itself is amoral. It doesn't really care one way or the other because it's not human. But what I realized was missing was my value on myself, and the love that I had for myself then influenced the way that I treated my diabetes management practices. So I find that we either make decisions from a place of love or from a place of fear. And a lot of times when we're living with diabetes, it's very easy to be fear driven because it is very scary to have an organ that does not work properly, that does not produce the right amount of insulin or any insulin, whatever the case may be. It's very scary. So that induces a level of fear. But we have, us humans, this beautiful brain. And I often define myself as 50% love and woo-woo and 50% science. I'm very deeply entrenched in scientific research, and I'm also very deeply entrenched in spirituality. And together, those two coming together allows us to create a relationship with our diabetes that feels like it's fueled by love instead of fueled by fear. And so when I say love, the main thing I kind of want to really drive in is that we get to create and nurture the relationship that we have with ourselves, which therefore creates and nurtures the relationship that we have with our diabetes, because everything is a relationship. So what I do for myself and what I teach other people is how to create and nurture a relationship with diabetes that is rooted in love instead of fear, if that makes sense.
I love that. Yeah. And it's so true that behaviors are either motivated by love or fear. I mean, you can, I don't think there's very many human, ways of being that can be summarized, but that really is like, you're either full of like, this is a great day, I'm a great person, I'm doing great things, or you're full of, why is this happening to me? I did it wrong again. I feel sorry for myself. I'm scared. I did the wrong thing. I don't trust myself. Right.
Yes,
we can kind of put a lot of our behaviors in one of those two categories.
Absolutely. All of them, in fact. You're 100% right about that. Yeah. So I agree. I was going to say, I can expand a little more, or you can go. I don't know if you have a second question or how exactly. I'm following Dr. Jody's lead.
Yeah, let's get into practices.
Yeah. So practices. So that's the thing about love. The other thing that I love teaching about love is that although if you look it up in the dictionary, it'll tell you it's a noun, I will be here to tell you for a fact that it's a verb. And if you do not take the time to change your perspective, your belief system, your thought patterns on what love actually is, and taking love from this like ethereal thought that's in your head, that's like something that you can intangible that you can't grasp, and putting it into a verb, which is an action or a practice that you engage with every single day or however many times a day that you're willing to do so, with the belief that nurturing and cultivating this self-love practice relationship will add so much value to your life and to your relationship with diabetes that it's very difficult to even put it into words. That's where the magic really starts happening, is in the daily practices where, you know, we have this, and I would used to say it was an American mentality, but it's really not. It's everywhere. We want everything yesterday. We want everything to be just, we put it in and it's done. And so that mentality doesn't really work with diabetes at all, or with love. It has to be a daily practice, and you have to become finding ways to become joyful and have anticipation and excitement about treating yourself with deep love. And what I kind of teach also in the same sense is called self-stewardship. And when you steward something, it means you, or whatever you believe, whether it's God or it doesn't matter, that's not the point, is that you are given the job, this amazing honor of stewarding this body, this vessel, this one thing that we have to move through this iteration of our lives. And so when you think of the way you react and interact with yourself as a self-stewardship, that you were given this beautiful task of caring, like for a garden, or like a, you know, a precious flower or plant that's been alive for 1,000 years, you know, the same thing is true of your soul. And so seeing yourself in that way allows us to find this joy in treating ourselves with love and respect and honor and empathy and compassion and non-judgment. That's a really, really, really crucial, important one, especially when it comes to diabetes. And love is non-judgmental. Fear is extraordinarily judgmental. That's how, so these are ways that you can tell if your practices are stemming from a place of love or stemming from a place of fear. Is if you feel like you're constantly judging yourself, or you feel like that's how you know it's coming from love. And I will go a little further to say how to get yourself to a place of love, mindset, emotions, feelings, is always through gratitude. Gratitude is the gateway drug to love. And it's a beautiful addiction to have, the best one in the world, in fact. That if you will be willing to sit down for a moment and practice gratitude, whatever that looks like for you, close your eyes, hands over your heart, and simply flood yourself with all of the things that you're grateful for. This could take 30 seconds. You're grateful for the roof over your head, the clothes on your back, the water that's clean that you have available to you, the food. If you have access to your medications, oh my God, that's a blessing. That all of these things, your family, your friends, your pets, all of these things, if you just take 10 seconds, you will immediately be in a state of love, right? Am I going to say it's going to last forever? No, that's why you have to keep practicing. So the practice leads to the progress of really always interacting with yourself from a place of love. And I won't get too much into it, but that will automatically spill out and interact with every other relationship that you ever have. It will increase the amount of love that you have for others as well.
Actually, when I was in med school, I learned that a 3-minute gratitude journal every night for 6 weeks proved to be a treatment for mild to moderate depression. And
I don't doubt that.
right. And it's kind of like if you do some sort of, weight training thing for 5 minutes every day, you'll eventually be stronger 24 hours a day. That little bit of weight training, if it's sit-ups or push-ups or a wall sit or whatever you want to do with your weights for a couple of minutes a day, you become stronger 24 hours a day. And I have been keeping a gratitude list ever since I heard about that study, whenever that was, 10 plus years ago. Now, I'm not perfect. I don't do it every night. And, but I have by far become a more grateful person. So that's a brilliant practice, just a simple gratitude practice at night. I love that. That's great.
Yeah, absolutely. So the practices are where it's at. And the other thing that I kind of like to, kind of as a foundational thing that I like to teach that fosters love is a mindset. So I think all of us who live with diabetes know that there's often terminology thrown around by everyone. And this is not an all judgment. It's just the way it is. You can see it in the American Diabetes Association or all. Fight diabetes. We have to fight every day. Wake up and fight diabetes, fight. So for me, I am really, really into etymology, the origin of words. I love to write. I love to understand language. And I also understand in the psychology of things that the words that we use to describe ourselves or other situations 100% dictates the emotional response that we have to that thing, right? And we use the words to describe it. So the word fight does not work for me. And I try to teach people that, so listen to the definition of fight. I wrote it down just because it's a violent struggle involving the exchange of physical blows or the use of weapons.
Ooh.
Now, who among us really genuinely wants to live a life where that energy is what we are pouring into the relationship that we're cultivating with our inner selves and our diabetes? Like for me, that's a 0% chance. And so what I teach is dancing with diabetes. And it might sound cutesy or corny, but if you really think about it and let it sink in, I wrote down the definition of dancing too. Dancing is to move rhythmically and fluidly, typically following a set sequence of steps. Now, both of those ways are ways that we can interact with our diabetes. One comes from a place of fear, and one comes from a place of love. And I always also like to add that when you dance with your diabetes, you know sometimes your diabetes might be wearing stilettos, and sometimes your diabetes might stomp on your foot. Doesn't mean that there's not going to be contention. It never means that there's an all or nothing mindset around this. Like Jody said, there is no perfectionism in my approach to diabetes, right? Because that just does not, that's like self-sabotage 101. You're aiming for a goal that's not realistic. So like I always say, if you tell yourself that the only way you're ever going to be happy in life is if you catch a leprechaun and a rainbow in a jar and put it on your desk, of course you're never going to be happy. That's how I feel about perfection and diabetes. That's what I feel that goal is equal to. So do the dance, have a back and forth, understanding that sometimes the dance moves are going to suck and you're going to feel foolish, and diabetes and you are going to have a little fight, and it's going to happen undeniably, but it's way better to dance than to fight. And that's how I approach things as well.
Beautiful. And Reva, I actually got this from you. Another word that I love is navigate. You know, we're navigating something that's very complex. So I know Danielle and I neither use the word control. Control sounds like you could put it in a box. Like you just do your insulin to carb ratio, you just do your correction factor, you just do your, you know, your basal rates are set and you are controlling your diabetes. And it's like, that's why there's so much burnout, right? Because we all feel like we can't control it. And so when you dance with it, not only do I love that, you know, that means you have different, you know, different songs that you get to dance with every day. It's every day is different. You get different outfits and different shoes, and you need different skills, right? You need to be able to do the slow song and the fast song and the salsa and the ballroom and the country.
You know, if I speak to control for just a minute, it's really amazing that those of us who live with this and really know we can't, quote unquote, control our blood sugar, and our health professionals who want more than anything to help us, but don't really have the experience of living with it. So they think, do this and that will happen, count your carbs and you'll have control. Yeah, it's an amazing myth that has really grown up because everybody wants sound bites and everybody wants to make things simple and easy. But managing blood sugar is complex. And the sooner we understand we can't control it, but we can actually learn what influences it and how to get it back in range when we're out, we're going to do a lot better rather than put ourselves against this impossible goal.
Awesome. Thanks, Reva.
Yeah, I couldn't agree more. I'll just add one more sentence to that. I always say you definitely cannot control diabetes, but you can control the choices you make around your diabetes management practices.
Beautiful.
That's my soundbite.
You can absolutely do that.
Yeah.
To some degree, because still context is important, right?
Always
resources,
context.
Skills, yada yada. But you can't
Always
control
subjective,
yes. You cannot control the outcome, no matter what you do. That's the reality.
That
agreed.
Now, sorry, I didn't mean to interject.
No, thank you, Reva.
No, apologies, please.
Yeah, I got Navigate from you. So so my membership program is actually called the Type 1 Diabetes Crew now, because the crew is we're all together. We have a lot of the crew members on the call today with Katrina and Susan and Lorna and Steve. We're learning to navigate the ship, right? Navigate all these crazy complex variables. And I love that we're having this topic, because when you take your foot off the control expectation, then we have a lot more love, right? Because you get to allow yourself to be human, which is another of my favorite topics lately in my group calls. is allowing for imperfection, allowing for like, oh, I didn't dose right for this, and oh, I didn't dose right for that, right? Because there is no count your carbs and put it in Pump Wizard and then Pump Wizard's gonna get it right, right? Like Pump Wizard drives me nuts because it's not a wizard, first of all, and it doesn't consider any other variables except how many carbs you're eating, which isn't enough. So when we embrace these words like dancing and we embrace these words like navigate, it is another act of self-love, because it's allowing yourself to have, you know, this attitude of your diabetes that you're like, I'm doing the best I can. Now, of course, we're not going to just say, oh, I can't control my diabetes. That means I can just eat anything I want and be 250 all day long. We all know we're not advocating that, right? We're clearly talking about creating a flexible framework, but I'm very passionate about making sure all you guys do have the skills to know how to properly navigate your ship, right? I'm not telling you to navigate your ship and you've never been on a ship and you don't know how to swim and you don't know how to read charts and you don't know how to assess the weather, right? We need the love and we need the actual skill set. So for any of you that aren't aware, I just launched a membership program because I've been doing, and as Daniele is, we both do one-on-ones with patients that we have for so many years. And my goal is that I can help as many of you as possible to really get this skill set for how to properly navigate and how to properly dance. Because my passion and my experience is that the majority of us have never received the full toolbox for how to sleep with a flat line, how to avoid going low when you're exercising, how to know how to dose for a high fat, high protein meal, how to adjust your dose based on a fast carb versus a slow carb, how to deal with being sick, how to deal with menopause, how to deal with cortisol, how to deal with PMS, right? All of these, there's so many variables. It's like we get this much training and yet we need this much, right? So this word navigate and dance, you also need to have the proper education. So obviously this is my kind of inspiration to all of you that haven't checked out my type 1 diabetes crew yet to check that out. We do live trainings every Monday. We do live Q&As every Tuesday. And so my intention, and there's many crew members here, you know, that probably vouch for how much they've learned already just in the few weeks that we've started. So I'll put the link in the chat. And I encourage anybody that wants a better A1C or wants to learn how to, you know, dose better for meals or not keep going low and high all the time to check it out. That's just my quick little plug. And now back to Danielle.
Oh, I mean, anything that you're going to learn from Jody on the medical side, Dr. Jody, I don't call her Dr. Jody because we're friends. I don't, but yes, I mean, if you want to know about the medical side of managing diabetes, you're in the right place. There's no question about that. And I've been grateful. She and I have either bi-weekly or monthly calls just, you know, to stay up to date on each other's lives, and the amount of love that she has put into creating this space for her membership program and how many conversations we've had about it. I'm very proud of what she's created, and I'm certain of the content in there is going to be, you know, better than, I mean, no offense to doctors at all, but like in the medical practices, but you're going to learn a lot more from Dr. Jody than you are from like Dr. Endocrinologist. And yes, so that's, but if you want to learn more about love, you can hit me up.
Yes. Perfect. Now I just vouch myself. I do bring love into my topics as well.
Of course. I mean, you can't not, because you're a very loving person. I mean, you're an empathetic, loving person. So yes, of course. Yes.
Awesome. Okay. Let's take a few questions or comments. If you go to your name, okay. So if you go to participants at the bottom, you click on participants, you go to the right, and now there's a column with everybody's name. You see your name, and then you put the cursor by your name, and there's a little box that says more, and you click on more, and it says raise hand. Oh, it does it? Wait, mine doesn't say raise hand. Or just raise your hand, turn your video on and just raise your hand. We can just do it like non-tech, old fashioned.
I was gonna say, I have the chat box up too, which I'm not usually really great at, but I see it. So if anybody, so I say, hi, Nikki. Hi, and thank you to Steve for watching the Diabetes Empowerment Summit. I genuinely very much appreciate that. And I hope, thank you for watching, and I'm glad you think it's great. I see hi to Elizabeth Peterson, who's my girl. See you now.
Nice name. Okay, well, just raise your hand if you guys have a question.
Yeah.
Everybody's giving a few comments. Now, one question I think, Lorna, you asked, is it best to do gratitude in the morning or at night, or does that not matter? It's best to do it when you will do it. It's best to do it when it's convenient for you. I mean, if you want to do it at lunch, if you want to do it after dinner, I mean, now I personally like to really seed my gratitude as I go to bed, because I've, as you relax, your brain waves slow down. They say that your brain is a lot more open to like, the input when you go to sleep. And then I like to think that I'm like sleeping in gratitude all night long, right? I'm like sleeping in this bed of gratitude. So I like to do it at night. But, in the middle of the day, if you're feeling like you're not having a great day, I also love setting my timer on my phone for 1 minute and being like, okay, 1 minute, I'm just gonna smile. I'm like, I'm alive. I've got fresh air. I can see. I've got insulin. Love all you guys. I have like all these amazing type 1s that we're connecting with right now. We have technology. We've got this video thing that we get to like talk to, I just film and I'm like, oh my God, I got water. I just flushed the toilet, like nobody's bombing me. And then I'm like, I'm already in a better mood.
Yes.
And then the other practice that I love is, now I'm going to send Danielle a little cute emoji and be like, babe, I love you. Because it feels good when you share love too.
Yes, absolutely. And I'll just really quick, just to add on, is that for Lorna, that's one of the biggest obstacles that I find with clients who I'm walking through getting into a daily self-love practice lifestyle, is this belief or this voice that says, well, you have to do it right. You have to do it at this time or with these parameters or with this guidelines or rules. The thing about self-love is it's unbridled. It's wild. It's meant to be that. It's not meant to be set up in a box with labels and rules. It's like whatever your self-love feels like, let bliss be your guide. Let joy be your compass. It's not like you have to check a manual to be like, when is the best, most effective time for me to journal, meditate, pray, state mantras, intentions, ground and earth with the earth outside. There's no time that's right or wrong. And I just want to really expel that whole possible little voice that might get into anyone's head about it has to be done in this right way. That's one of the biggest obstacles that people have to get over, and trust yourself about what feels good and really start understanding how that works in your own life. It's very individual.
It is.
And so whenever it feels good for you is the right time.
And
it doesn't have to be the same every day. It doesn't have to be the same every day. Yeah.
That's the thing I've learned too, is like, I do a lot of charts where I'm like, okay, I'm going to meditate every day, or I'm going to do sit-ups every day, or I'm going to, I don't know, drink X amount of water every day. And I'm finally learning that I can like miss a few days and just keep going. Like,
totally.
So I'm, instead of like, oh, Jody, here you go again. You missed, just throw out the chart. So love, like that's one of my favorite ones.
I see Nikki has a question. I don't know if you can like,
oh, yes.
I see the hand thing. Oh, okay. Because I don't know how this works. I'm not Zoom like hand raising savvy. Yeah. So I don't.
We'll go to Nikki in just 1 sec. I just was going to say that, like this, just allowing yourself the imperfection is such an important part of love. Allowing yourself humanness, allowing yourself to like not, like, don't beat yourself up when you don't do your diabetes, the way you think you should have done it or whatever. Or if you're, practicing your gratitude and you forgot, this whole like these like 90-day challenges, like every day do this. I'm always like, how about like 80% of the time do this? That's good enough.
I feel the same.
Okay, Nikki, I will unmute you. Ask to unmute. And Nikki, I have not seen you for ages. Nikki came to my first retreat. That was so many years ago. And
look, I'll start the video, but I have a whole coloring situation going on here. So
that's a hair coloring on. I'm happy to see your smiling face. Oh my goodness.
We were all together at my first retreat. This is so good to see.
Yes, we were wearing the same shirt.
Yes, I didn't put it on today, but something similar. So thank y'all for doing this. And yes, I learned so much from Dr. Jody because I connected with her right after I was diagnosed, and worked with her privately for a little bit, and then went to the retreat, and then I met Danielle, and I've been able to participate in the empowerment summits, and that's all been wonderful. And I have as I think both of you know, a very committed gratitude practice, and it feels so good. And for me, it's not for everybody.
Thank you for posting it on Facebook.
And I was just about to say, and for me, I posted on Facebook because I'm trying to seed it into the world so I can feel it coming back. But this year, 2020, lots of anxiety that I would have never in my life described myself as an anxious person. And I have been triggered to bouts of anxiety that were like nothing I've ever encountered. And I found myself, giving into the diabetes burnout in the middle of that as well. I've worked myself out of it, turned the corner with some additional practices that I had to put in place to, including a mantra of let my faith gently dispel my anxiety. And so just kind of focusing on that. But I wanted to see if either of you had any thoughts or tips about when your routine practices don't feel like they're enough.
Brilliant question. Danielle.
Well, I can say that I've had a very similar experience to you in 2020. I think most of you who know me well, anxiety is really not something I struggle with at all, and I'm very grateful for that. However, in the tumultuous, I don't, excuse my language, shit show of a year that 2020 was for most people, I also had to implement a bunch of new ways. And really what I had to do was just give myself all kinds of space to say, I don't know what I need right now, and that's okay. I know I'm not okay. I know that I need to feel better. I also know that I'm grounded into my, very deep gratitude practices, praying. Grounding with the earth is a very big deal for me, touching the ground and communing with nature. But I don't want to say it wasn't enough, because that's not what I mean, but I needed more. And so for me, what I did was just kept speaking to people that I trusted on a regular basis, and just was very clear about not being okay and being okay with not knowing when I would be. I think that was the biggest for me, was just like, I'm a very action oriented kind of like, let's get this to a place of resolution type of place. So for me, when that was not possible, and I don't think for any of us it was possible, or maybe even is now, it isn't for me either right now with my mom living with stage 4 pancreatic cancer. It's like, I'm okay-ish, but like, I think for me, it was just saying, I don't know what I need, and I'm okay with that for now. I'm just going to continue taking care of myself and being present. I don't know if that's helpful. But for me, it was really just admitting that I don't know, and allowing myself the space and the grace to be okay with not knowing for the time being. That's how, I don't know.
And I'd love to know, that's beautiful, Danielle. That's great. And that dovetails exactly. My answer is that the first thing is that we're okay with being anxious. Like, don't make that a problem, right? Like, you're like, wait a minute, I'm full of gratitude, but I'm actually not right now. I'm kind of scared and I'm anxious. And then I tend to be like, well, Jody, why isn't your gratitude practice working? Why are you anxious, right? Well, who could be in the best mood of their life all last year? I don't know anybody.
Yeah.
Right? So the first thing is like, I'm anxious. No judgment. My regular practices aren't calming me down right now. No judgment. Maybe I'll just sit here as if I am embracing my anxiety, going, wow, this is tough. This is tough. And that's the best you can do. This is tough. I'm going to just sit here with my anxiety. We are a culture of wanting to take a pill if we're feeling off, or, drink something if we're feeling off, or eat something if we're feeling off. That's my tend to go to. Shop if we're feeling off. And I say, just feel off. Just feel off. Just feel anxious, and have that not be a problem, right? That's part of the whole process of being human. Like, I've been working with this life coach, and she goes, Jody, nobody's happy all the time. That should never be the goal. That should never be the goal. Don't judge yourself on how well you're doing in life, on how happy you are all the time. So so Danielle's comment is exactly like, what do I need right now? Because she's just accepting what is, right? We're just anxious. And so let that be enough.
Thank you, ladies.
You're welcome. It's so good.
Thank you, Nikki.
Yeah, great. Okay, so we have a comment from, let's see, Beyonda, who's one of our crew members. Beyonda asks, and Beyonda, thank you for representing Australia. Beyonda's calling in from Australia. Is patience part of self-love? Oh, yes. I'm struggling with patients around diabetes. Any tips while waiting for the insulin to work? I get anxious. The blood sugar's not dropping quick enough or not going up quick enough. When out of range, it drives me crazy. And I know it shouldn't. I should just get back on track. Well, I will give that one to Miss D.
Well, yes, patience is a massive part of self-love because it goes right back to that mindset of wanting everything yesterday, wanting everything to happen in an instant. You snap your finger and this is the result. People come to me, with their A1C really, really high, or maybe their body weight is in a place where they're not thrilled about it. And they're like, well, how's the quickest way we can get this down? I'm like, we're going to take a step back from that. And we're not going to worry about what the quickest way to do this is. We're going to worry about what's the safest, most sustainable, healthful way that's going to build joy into your life, that we can work through this so that when you get to where you want to be, you don't still have the same conditioning that you had when you first came to me that's going to spur you to go right back to the same actions. And so patience is a huge part of self-love, because when you're not being patient with yourself, what that equates to on the other side is that you're judging yourself. You're judging your blood sugar for not coming down quick enough. You're judging yourself for maybe whatever reasons that your blood sugar is too high or too low, or whatever label or meaning that you're giving to the numbers, right? And, at the risk of being repetitive, but I think repetition is the mother of skill and understanding, is that, the data points that we get from our glucometers, from our CGMs, from any numbers that we see, they're simply data points. It's us, it's our mindsets that puts that emotional feeling and attachment to it. So when we can take a step back and say, okay, my blood sugar is 250, I need to bring it down. I'm going to get whatever your correction factor is, or whatever the case may be, and I'm going to allow nature to take its course. And for me, something that I do when I'm low, and maybe it helps too if you're high, is that I do something to take my mind off of it. So for me, my trick for being low is taking my 15 grams of carbs, or sometimes it's more depending on how low it is, and then I'll color. Or I have this little sticker book, like where it's like a kind of like a sticker by numbers, like where you just peel the sticker off and then you put it in the right place. So I'll do something mindless, but that takes my hands to do something, so I don't keep trying to go eat more stuff. And it might be something good to do to refocus your energy when you're high and you're waiting for the insulin to work, to put your focus and energy and attention on something that could bring you joy, like maybe some artistic or creative expression. Even if you're not artistic, that's not the point. Creative expression can be anything. There's no rules around creative expression: cooking, dancing, painting, singing, art, throwing paint up against the wall. Like, that's artistic expression. So maybe something in that realm that can help you be more still while you are in the phase of seeing what happens next with your diabetes. I'm not in the business of giving out medical advice, and this is not medical advice, and I don't know if it's available in Australia, but I've been using Afrezza for 4 years, and I'm not recommending it unless somebody wants to try it, but it's inhalable insulin that brings your blood sugar down within 15 minutes. And for me, it has been a game changer, but I also don't work for Afrezza. I have no insider information, so I don't know where it's available. You can go to their website. It's AFREZZA. It's inhalable insulin. Like I said, I've been using it for about 5 years now, and it basically just takes the time out of range from 2 hours for your insulin to work, for 15 to 30 minutes for the Afrezza to absorb. So for me, that's a possible thing that might help some people.
That's great. And so I think Danielle and I are such a great pair, because there's and we both do both. We both focus on love and skills, but Danielle is leading with the love aspect, and I, because of my title, lead generally with the skill aspect. So she just talked about all these brilliant love tactics for dealing with things with highs and lows, but from the skill aspect, right? Anytime you're high, if you want to go on a walk, you will make your high come down faster. You don't have to just sit and wait for your high to come down faster, right? You can always, the more insulin on board, the faster it'll come down. But patience is hard for all of us. And beyond it, because you're a crew member, I would love for us to talk about this on our next, our either Monday education video next week or our Tuesday Q&A, because I would love to dive deeper into this with you. But yeah, it's definitely a combination of the attitude that we bring, but also, like I said, the skill set that we bring, so we can avoid so many highs and lows as well, right? There's only one thing that causes a low. There's only one thing that causes a low, right? Improperly dosed insulin, too much insulin. All my people know that. There's only one thing that causes low, right? So if you're having lots of lows, we need to look at why you keep taking too much insulin, right? Exercise doesn't cause a low. Exercise causes insulin to work faster, and then you have a low, right? If you don't have any insulin on board, which is not a good idea because you'll go into DKA, but if you have no insulin on board, it's impossible for you to go low. You cannot go low when you have, now, I'm not telling you to have no insulin on board. I'm just making a point that the more skills you have can also reduce your anxiety, right? The more confidence you have. That's why I have so many patients that come to me and they're like, oh my God, I'm so scared of this disease. I'm doing what I'm told and it's not working. I'm like, well, yeah, because you were told like 10% of the 100% that you need to know, right? So anxiety is also, but beyond that, you're already doing that, right? You're already in the crew. You're already learning every Monday, new skills. So, it's one thing to be like, okay, I can breathe through this anxiety, but it's another thing to be like, and I confidently know what's going to happen. And I confidently know how to avoid this situation next time.
Can I say one other thing as well? Is that okay for 1 second? Because there was a person, Winter Flower, she had sent me a message, and this I think is really important for us. It's a skill thing that I do, and I totally understand. So she was basically saying that when her blood sugar goes higher, what's really annoying for her is that the Dexcom alarm keeps going off until it comes down. And that is something so I am a very big proponent of, we are only as kind of helpful to ourselves as our willingness to learn how to use the tools that we have. And the Dexcom is a very comprehensive tool, and we can use it just a little bit, or we can use it more. And so for me, so let's just say my blood sugar is high, right? And I already got the alert, and I already have taken the action that I'm going to take, whether it's a correction bolus or I'm getting ready to take a walk or whatever the correction action that I'm going to take. I go into the settings, which is, I use mine on my phone. I go into the settings and I push my high alert up to like 300 so that I don't need to keep hearing that alarm every 10 minutes. Because I already took the action. And so, but then for me, what I'll do then later is when it comes down, I go back into the settings and I toggle it back to where my high alert is. For me, my high alert's at 150. That's not me telling you need to do that. But the point is, I toggle my high alert all the time because I don't want to hear all that beeping either. It would drive me absolutely nuts. And I totally understand that it's driving you nuts because it would. You can turn that off. And then you can, once you get into the habit of turning on and off or pushing up and down your Dexcom high alert line, when you start doing it daily for multiple different reasons, it'll just be like second nature to you. You won't even have to think about it. But if you don't start doing that now, essentially what you're saying is, I'm cool with listening to these beeps forever and driving myself crazy, which for me is just like that's not happening.
And another piece though, Dee, is that I'm doing it right now. You go into alerts and then you go into high alert, and then there's a repeat. And your repeat, you can set it, which means I have my high repeat set at 45 minutes. So that means that it beeps at me because I'm high. I acknowledge it. I clear the alert. It will not beep at me again for 45 minutes.
Great. That's another thing. I didn't even know that was an option. Yeah. So yeah, there's options. We got to learn how to use our tools because that beeping.
So here's my high repeat, 45. It gives you all the way. So go to your repeat. Same with lows. You can save and so that's the same. Danielle and I are giving you two different ways to avoid the alarms. Yeah. And
yeah, that's a beautiful thing. There's so many ways to do this. Just, find what works for you.
Oh, okay. She says, I'm constantly, and mine's beeping at me now, 1:30. A little anxiety a little excitement to be on the call. I'm constantly checking my CGM when my blood sugar goes up past 200 for whatever reason. I start to freak out. So I'm constantly depriving myself. I eat the same foods. I exercise daily, but continue fear. I fear complications and any rise in my A1C. So basically I'm depressed because I feel I'm just existing, not living. I'm sorry, Winterflower, join my program. You need more skills. Like that's exactly the anxiety that is existent in so many type 1s because we don't know what we're doing. And we have all this fear because we haven't been empowered to be like, oh, I know how to avoid 200s. I know how to have it come down faster. I know how to exercise and, get my blood sugar in range. I know how to eat this thing and dose differently. We haven't been taught how to dance with diabetes, right? Which is why you're existing and not living, you say. And we haven't been taught how to navigate diabetes. We need to be able to dance and navigate so we can dance and navigate through our life and not live in fear. So So winter flower, in my opinion, you just need a better toolbox, a bigger toolbox. So because if we don't know what we're doing, it's scary. But when we do know what we're doing, we can take a deep breath. We can avoid the 200s. Like, so yes, please reach out for more and I'll put the link again because it's kind of gotten lost in the chat. Type 1 diabetes crew, come join our crew. All right, so Freza, everybody's saying yes. Freza, Nikki says yes, make changes, alerts to keep yourselves from going crazy. Perfect. Steve, tweak the alerts, fellow crew member. I love that. Walter Perry, I wish I had a pump. Hey, Walter, I don't have a pump. I don't wish I had a pump.
That's everybody has their own choice. Yeah, and I want to say that too. I want to back Jody up on that. I've been working with people with diabetes for 11 years, and I will never say this is the only way or this is the best way or that's not a thing. It's whatever. It's the same way with self-love practices. It's whatever works for you. I know people who have excellent A1Cs who are on manual injections and people who are excellent A1Cs who are on pumps. Out of my 30 years, I've had a pump for 7 or 8 of my 30 years with diabetes. Prior to that, manual injections, not even pens, syringes right out of the bottle, right out of the vial. And that was fine until I went on a pump, but that was a personal choice. And so you can succeed.
Yeah, I don't even like pen needles because I feel like they drip. Catherine, I see you. I tell people to get syringes and then I pull the insulin out of the syringe because then I can do a half unit, I can do a skinny half, I can do a fat half, and you don't have to sit there and hold it for a count of 10. And because I always feel like every time I do a pen shot, it drips. So I'm a big fan. So Walter, again, I kind of the same answer that I gave to Winterflower. It's like education. If you have better education for how to manage your shots better, you'll probably get what you're looking for. And this isn't judgment. This is just reality that most people with type 1 haven't gotten the education that they need, which is why I'm on a mission to attract thousands of people to my membership program, because my membership program is all about education. It's $47 a month. You get education from me every Monday, every Tuesday. Then you have the whole group of people that are working together. I'm just passionate. It breaks my heart to hear so many people with 7, 8, 9, 10% and higher A1Cs going, well, I'm just doing everything I'm told and it's not working, right? Okay, so thank you so much. Oh, good, Winterflower. Thank you so much for the great info. I will do this. Callie, love setting the basal rates. Yeah, Callie is a crew member. We worked on basal rates last month. The basal rates are your foundation. All right, well, we're gonna wrap up soon. Oh,
I think Catherine has a...
Yes.
Oh, okay.
2 things. Sorry, one comment and then Catherine's question. Speaking of words, the word that I love, now you might not agree with me right away, is discipline. Because discipline doesn't mean it's like this military thing with like a whip. It's you become a disciple of yourself. You're a disciple of your own body. Right? Going to bed at the same time, or, doing what you need for your food, or doing what you need for your diabetes, doing what you need for exercise. Some people say it's very good discipline, right? But it's not in a negative way. It's because you are your own disciple. I love that because I used to not like the word discipline, right?
I love the word discipline. And again, not in a militant way. My husband is ex-military, not... To me, it's like and I'm a big fan of rap and hip hop music. That's just, who I am. And Eminem has a line, and I'm sure it's the wrong, but he's like, I'm a bully. I make myself do the things I want to. Yes, like that to me, that's like, so if you want to do these things, you want these outcomes. I want a better A1C. I want to feel better, more energetic. Discipline is essentially you bullying yourself into doing the things that you actually want. So if you just think about it logically, like it's a beautiful thing. It's part of stewardship. But yes, yes, I totally agree.
Catherine, the floor is yours.
Oh, just quickly, back to love as a practice. When I first got diagnosed, because I'm one that got diagnosed as an adult, I felt like there was so much fear, just suddenly, fear of dying all the time. And I thought, I gotta reverse this. So something I wanted to pass along, if it works for other people, is I have to take insulin. And at that time I was doing finger pricks. Now I have a Dexcom. I have to take insulin every day, multiple times, and I have to prick my fingers. So I made a meditation that every time I did that, instead I was flooding myself with sweetness and love. And I even associate it with the color pink. And it would just be flooding myself with pink, flooding myself. I don't dose in my arms. I don't know what I'm doing. Flooding myself with pink, flooding myself with love, flooding myself with sweetness. And after a while, I had this conditioned association that what had been a trigger for fear and anger and resentment became an occasion for being flooded with love. And that way I didn't have to remember to do it. I mean, I do have a gratitude practice now, but I didn't have to remember to do it, and I didn't have to, I mean, the wolves would still come like galloping across my psyche. I love the thing today about accepting anxiety and accepting fear, but I'd had a counter narrative, I guess you could say, or like how I also have this. So I appreciate all of you, and it sounds like Reva's a teacher too, all of the teachers, and Jody, I love being part of the educational program, and all my peers, and in this new crew, but just thank you.
Yay.
So
Thanks,
awesome.
Catherine. That's beautiful. I'm going to use that. I love
So
that.
beautiful. Yeah, she created what you did, in psychology, it's called you created your own anchor, which means that every time you do it, you're immediately reminded, and you made that expand because you actually associated a color with it. So there's a lot of different things to create an anchor, associating a color with it, a noise with it, a visual representation, a smell. If you create all of these different sensory inputs to one practice, it's like you can recondition something that's filled with fear into something that's filled with love in a much shorter time than one might think, because the human brain is very elastic and very willing to accept love once you start pouring it in there.
Beautiful.
That's amazing. Congratulations for that. So amazing.
Danielle, this was like, I think, the coolest thing you and I've ever done.
Really? Even in person? No, I'm just kidding. No, I'm just kidding. It was amazing. Absolutely. This is so much fun.
So
Super
good.
fun. Yeah.
So good. So good. So maybe I can talk Dee into doing more of these with me, because I'm certainly up for it, but we'll see. Thank you. So as all of you know who follow me, this is a time that you took. This is self-love. Right now, you're practicing self-love, because I know you have 100 things to do, but guess what? You tuned in to this to hear and listen about love, right? You just filled yourself with connection, community, inspiration. And it was, I thought maybe it'd be half an hour. It's now been 53 minutes, because I'm kind of flexible with time. I don't like to cut things off. And you guys as my group knows, I call it the emotional gym. You just went to the gym for your emotional health, right? We need to go to the gym for our physical health. And now hopefully you're all feeling like lighter and more inspired and more connected and have these attitudes of gratitude, right? You just went to the emotional gym. And, my people go to the emotional gym, every time we're on the video. So it's time investing in yourself to improve your body. And now we just invested in ourselves to improve our mind. And let's see, Michelle says, will there be a way for us to rewatch the session? Yes, if you're on my email list and if you're in the crew, you have to be in the crew. The recording will be in the crew. So I'll paste once again the link to the crew. And you guys know, I'm not selling anything. I am passionately encouraging everybody with type 1 to get the education that they need. That is where my passion comes from. I happen to make it my career. So yeah, I happen to charge because I kind of need an income. And I think I've made it incredibly affordable. Like you can learn how to knit for $47 a month, or you can learn how to run your diabetes for $47 a month. Okay. So that's kind of, my passion is like, my goal is to have thousands of type 1s empowered without fear, without burnout, with A1Cs below 6.5, not afraid of lows, not afraid of highs, not afraid of exercising, confidently adjusting their dose for different meals, confidently traveling when we can travel, right? Living a life that's empowered and full of love. And to do that, you've got to have the right education and you've got to have the right support. 2 key points, education and support. And that is what my program offers.
Yes.
So
I'm going to say one other thing. Yes, definitely go join Dr. Jody's program for education and support. You'll never hear me say anything other than that. And just in the name of love, because love is everything and everywhere, there's somebody on this call who I love who just got married, and I just happen to know that, and that's Sarah McLeod, who's not Sarah McLeod anymore, because I don't know what your new last name is, but like a couple of days ago, this amazing woman just got married. So I just want to honor that because I love her. Yeah.
Congrats, Sarah. Oh, Petty, Sarah Petty.
Petty. Okay, now I know your new last name.
All right. Okay. Well, stay tuned. My goal is to be doing live interviews with different experts every single month in the T1D crew. So this one I wanted to open up to all the type 1s that we know, because I mean, I'll be transparent. I want as many people to join the crew as possible. So this is my way to inform everybody of the crew, show you the value that's available, show you the community that's available, show you the training that's available. And I've put the link in the chat like 25 times. So there it is. Or you can just go to my website. To find my website, all you have to do is Google Dr. Jody Diabetes and I come up, and the crew information's on my website. So I cannot thank Danielle Love enough. I love you dearly. I love you just dearly. And I just love everybody with type 1. I think we're on an incredible journey together. I think when we rise above this challenge, we're incredible heroes. You know, I have a whole video called Why We're a Hero. And the hero is an acronym for we have exceptional resilience over and over. And we do. We have exceptional resilience over and over. That makes you a very it just strengthens your character. It strengthens your character to more empathy, more understanding, more beautiful discipline of yourself, and so many more. So I hope to see all of you in the crew, and thank you so much for spending time with us. Thank you, Danielle.
Thank you for having me.
Yes, thank you, Riva, for your cameo and your inspiration. I love all of you guys. So have a great day. Great day. Bye.
Bye, guys.
Love you. Do this on our group calls. Send love. Love. Bye. All right.
Bye. Thank you.
Thank you, everybody.